I think honestly, it's elation. I think that men that have wanted to do this for a long time, and have really been kind of thinking about it. Weren't really sure. Well, I don't know. I don't like that strip technique. They worry a lot about the donor scar. They want it to look natural. I don't want these cornrow, effect. I mean, the procedure we're doing now, patients wear their hair wet and slicked back. I've got one patient of mine, a gentleman, very active guy. He's like in his late 60s, and he'll send us every now and then. He'll send us pictures. Well, we've asked him, "Kay, can you send us some, how you're doing?" The photographs come in, but he travels all over the world. He just sends us pictures. Like he sent pictures from the Cayman Islands, and he was there, and his hair was all wet, and he was in his wetsuit, and he just, he just was so elated at how his hair looked, and the fact that how he felt about himself. And I think that's the thing that men tell me over and over again, and I can relate to as a guy, is that it really does make a difference if it's something that truly bothers you. It doesn't bother everybody, but I mean, for most men, losing your hair is not in the top. It's not in your bucket list, let's say. And so it really does make a difference for patients. That just that self-confidence that they have. We see them back in a year, and they've got hair growth now where they didn't have hair growth. They've got more hair than they had before. And it's fun to have them look at their picture beforehand, because sometimes they forget how different it looks, and they're very surprised, but excited. Certainly with women, we do some eyebrow transplants too. Some women that overpluck their eyebrow hairs will transplant to there. Women that have had facelifts where the hairline's been raised up too high and they've lost the hair in front of the ear, or there's a scar going down the back of their head that they can't pull their hair up in a ponytail because they can see the scar. We can get rid of those. We can graft right into those scars. We can lower a patient's hairline that's had a forehead lift or a brow lift that's raised the hairline up, so you can make them more youthful, make them look younger. So there are multiple applications for patients. We've had patients that have had cleft lips, guys where it's altered their mustache distribution. We can go in and graft into that area, other places on the face. So a lot of really exciting applications for this technology.